So, Edwin, you trained in the UK.
Yeah.
I'd be really interested in knowing how you feel BSPRM has grown or changed in the past few years, and whether that is something that is reflective of training programs in the UK, and similarly how the BSPRM has evolved in the past few years.
I think it's been transformed, and it's transforming the specialty. So I think there's been attention to the wider scope that the specialty can serve. Real thought now about trying to get into undergraduate curricula, because doctors of tomorrow need to understand people with disability, hear their voices, work with them. So that can be really fruitful. The second thing is that there's been a much greater recognition of the sort of skills that rehabilitation brings, and the commonality with like-minded specialties such as medicine of the elderly, palliative care, community paediatrics, where the negotiation of difficulty and conflict is at the centre of what we do.
Yeah, I'm with you. Coming at it from a rather different perspective, as I'm Canadian trained, so I had the benefit of working and training in a country in which rehabilitation medicine is much deeper and more established in North America. I feel that BSPRM aspires to achieve that recognition and prominence in the UK, and to bring a specialty up essentially to international standards. And frankly, we're not quite there yet, but I think we're on the right path. So I'd add to the list of commonalities that you were describing there, which are the attributes of a generalist, I think, and the generalist's role is hugely valued, and it's largely missing in the silo-defined structures of training and practice in the UK. But add to that musculoskeletal medicine and paediatric medicine modules are being introduced now in training. So the content of training programs, I believe, is growing, and we're promoting that, I think, at BSPRM. And secondly, it's involvement at undergraduate level and within training at undergraduate level and at fellowship level. I believe there's a real recognition that we need to physically exchange students for months at a time in and out of our respective specialties. And I think that will again support the goal of establishing a much more widely respected, accepted specialty in the UK. And then I believe that we will reach that international threshold where we can cross borders, literally cross borders with our training.
Well, I think what's good about the conference here is that we've got international speakers in recognition of that. And I completely agree. I have part of my work is in cardiac rehab, and recognising that breadth of scope, working with different colleagues in different specialties, and bringing that generalist vision is going to be really important.
Absolutely right. Well, we have a lot of work to do ahead of us, but I believe we're on the right track now, and I think we have a plan. We have a newly configured constitution. The curriculum has been enhanced. I think we're really going places. I'm confident.